I love it. That's funny. This is Dr. Bouvier and Michelle. We're here
Hi.
with the Congestive Heart Failure Program, and this is an explanation about the tests that you've taken already, and you come to the video to learn more about congestive heart failure, and so you can answer the post-test, because the post-test is the same as the pre-test.
Yep.
The idea is through repetition, you understand what we want you to do. So what we try to follow is the philosophy of people need to know what's going on and how it affects them, right?
Correct.
So what we're expecting the CNAs, you guys listen to this, and the MAs and the people that are the frontline people here at the facility, is, or caregiver if it's out of the facility,
Yep.
is for you to understand a little bit more about what we want you to do and report to the medical people, the RNs, the NPs, and the physicians as we document from a day-to-day basis. And sometimes it's hour to hour, day to day. Because if we're in the middle of treating somebody and we say that they're wet and they're having one of their exacerbations, we can treat them at home. They don't have to go to the hospital. The whole idea
Definitely.
of this program is to inform people and then give the patients a chance to catch the congestive heart failure early in the disease state so we can help keep them out of the hospital.
Correct.
Great. This particular program, we've had similar programs across the United States. The one in Minnesota is the most successful, and we've been able to reduce the hospitalization rate by 55%, which is what our goal is here. So you're the most important person to help us implement this program and make it work from a day-to-day basis, don't you think?
I agree 100%.
Yeah, I mean, you guys are the
Eyes and the ears
You're
of
the
the
front line,
facilities.
and we appreciate all that you do very much. So the first question here is, what is P&D?
And it's proximal nocturnal dyspnea.
Right. So basically, when people are sleeping, and you probably heard this, if you've been working anywhere with heart patients for very long at all, for a year or less, you're going to know that these people wake up short of breath, and what happens is their lungs fill up with water when they lie flat, and gravity just kind of fills things up, and because their heart pump's not working too good, and they wake up short of breath. That's because they're having air hunger, right?
Yep.
And that's PND, paroxysmal nocturnal dyspnea. The other four questions here: postnasal drip, postnodal dyspnea. It's just obviously not the right answer. So it's paroxysmal nocturnal dyspnea is the answer to the first question. The second question is orthopnea, which is related to PND, and these two together are kind of like when we want the CNA to go in and talk with them. We want them to kind of ask that question: how'd you sleep last night? Were you short of breath? How about when you're lying flat now today? Are you short of breath at all? No, I'm feeling good. So the patient gets to know that you're interested in that question, and we ask the patient to say, okay, are you in the green area, which is that's my baseline. I feel
Yep.
great. To yellow, I say, I might have a little more short of breath than I have over the last week or even days. I am a little more shortness of breath. That's kind of in the yellow. The red is they can't talk in complete sentences
Like
without
a fish
taking
out
a
of
breath.
water,
Right,
so, yeah,
exactly, like
so.
a fish out of water. So they're either green, they're doing great. Yellow, they're having a little bit of a problem. Red, they're having a major problem, and we need to jump on it like now.
Definitely.
But the yellow is like, okay, we need to find out what's going on here. So in the documentation, we do want them to put down yellow in the
Yep.
documentation for that day. And we'll go through this a couple of times and explain to you what we're talking about. In fact, in a different video, we'll actually explain exactly the documentation process. So the third question is, why do we do daily weights? I like my first answer. I mean, that's kind of my, just another documentation criteria to frustrate the working staff.
Yeah,
Right?
definitely.
No, it's really important. This is a really important one here. This is definitely
Yeah.
everything we're talking about. This is the most important one that we're talking about of those criteria, right?
Yeah.
So basically, we we document the weight to check the stability of the congestive heart failure, and when we've got a base weight, let's say it's 209. If it what is it, Michelle? If it goes up by
3 pounds in 48 hours.
in 48 hours,
Yep.
that's like takes it from a green to a yellow.
Mm-hmm.
And people may not even feel bad, but we know internally amongst us here at the working, the people working here, that that is like a flare going up. We
Yeah.
need to let the nurses know and
Yeah.
take you from a green to a yellow status.
Correct.
Right?
Yep.
A quality of life status would be go from a green to a yellow. The other ones obviously are not right. Number D is kind of a trick question, or a trick answer. If the weight goes up, it improves the CHF. Actually, it's the other way around. If the weight goes up, it's actually getting worse.
Yeah, correct.
And so So it's really important that we document those weights, and that's why we do it first thing in the morning because they haven't eaten. It's their kind of their driest time of the day, and it's kind of what we've used as their established weight.
The
You know,
most
shoes
accurate
off,
weight. Yep.
you know, bedclothes on, you know, yada yada yada. What is CHF?
Congestive heart failure.
Right. So it really goes along with 5 here because congestive heart failure is just what, you know, the shortness of breath and the results of the originating problem. And the originating problem could be, like for answer number 5, the answer to the number 5 is really all the above, because it could be from high blood pressure out of control for many years. It could be hardening of the arteries, right? That's out of control. Could be from a previous MI. Could be from a virus, heart attack, myocardial infarction. Could be from a virus. There's a virus called Coxsackie B that can affect the heart. Usually those people are younger, and you know that's one of the reasons why we do heart transplants on people, was because you can't fix that.
Yeah.
You can't put a new artery in, or you can't stent it or something. Just from plain old aging, people, you know, the heart gets stiff and it doesn't pump as efficiently anymore. So that aging problem really does make a difference. The iron deposition is a problem too, and as we grow older, sarcoidosis, it's a certain infiltrative process. You probably had a few patients with sarcoid,
Yes,
and it
we
can
have.
cause a heart problem. Actually, emphysema and COPD, you know, lung problems can cause it, and it's usually from the right heart failure compared to left heart failure. But it's okay. Obviously, from a heart attack, and there's a whole lot of other reasons. You know, lupus can cause it. You know, people that have very high iron for a long time can cause it. Even certain sleep apnea. When the oxygen goes down for any reason, the heart pump can fail, and that can build up within literally seconds to minutes. Your lungs. We call it flash pulmonary edema, and that's one of the things that can happen too. So people with sleep apnea, uncontrolled sleep apnea, can cause it. So these are just a few of the things that we want you to understand and hear about. So go through this video again, and all the answers are in this video.
Yep.
We want you to have 100% and really walk away from this, you know, understanding a little bit more about congestive heart failure and what we want you to do, because we want you to document the quality of life scale, which is green, yellow, red, and we're going to have a video about that again, and then the daily weights we wanted to
Definitely.
and right now we're documenting Monday, Wednesday, and Friday.
Monday, Wednesday, and Fridays.
Okay. We'll probably keep to that, don't you think?
I believe so. I
Yeah,
think that's
yeah.
the best.
Yeah, I mean, this gets too cumbersome after a while.
Yeah.
But,
Yeah, but if
for-
you, go ahead.
no, you're
If
good.
you have any questions or concerns for either myself or Dr. Bouvier, we'd be more than happy to address those concerns with you. So.
Very good. Again, this is Dr. Bouvier from Dr. and You. We're talking about the congestive heart failure. Really glad that you're participating with us. Thanks
Yes,
again.
Thank you.